So if we're starting off with diagnosis before we come to treatment, then the answer is unequivocally yes, there is. And of course, you may have seen the EPR guideline as well, on the use of FeNO in asthma. In fact, I wrote an editorial on that in the Journal of Allergy and Clinical Immunology last year. So yeah, there is definitely a role for it. For example, if you look at the NICE guidelines, the UK NICE guidelines, then FeNO takes a prominent role there. So after performing spirometry, looking for airway obstruction, looking for reversibility, then right up at the top of the algorithm, FeNO's right there in terms of a FeNO level more than 40 parts per billion in steroid naive adult asthmatics. And then the algorithm goes down and also looks at diurnal measurements of peak flow, and then airway hyperresponsiveness using bronchial challenge. I know certainly in my practice, everybody that walks through the door, as well as getting an asthma control questionnaire, an ACQ, while they're in the waiting room, they all get measurement of spirometry, FeNO, and in my clinic we also look at small airways function using airway oscillometry. I would actually feel quite naked, if you like, clinically naked, not physically naked. That'd be an unpleasant sight, but I would feel clinically naked if I didn't have the FeNO measurement when I'm assessing my patients for the diagnosis of asthma and also for the treatment asthma. It's something which is now completely integrated into our clinical pathway and is done as a matter of routine at every single visit, not just at the initial visit for assessment, but at serial follow-up visits as well.